My name is Henrik Ibsen. I am the CEO and founder of OpenTeleHealth. We have been doing remote care and remote patient monitoring for 10 years now. We have created a platform that allows our partners to deliver healthcare to people, very much based on the philosophy behind open source and as open as we can be in that way. We are kind of like in the B2B market as an IT platform, definitely focused on the segment of healthcare and healthcare providers. In acquiring new clients, it's always a matter of finding the right people at the right time. You need to cast a very big net to really do the good catches. If you're an IT organization like ours that are not that big, we don't have the financial muscle to build out a sales department that can screen and fish in the market with a very, very big net. So the biggest challenge for us has not been technology. It has been being on the radar of those who want technology. If they do not know we exist, they cannot possibly buy from us anyway. We chose to work with Belkins because somebody knew them already and had good results from the work they did. If you find something that works, well, like they say in the US, if it ain't broken, don't fix it. And we have tremendous positive results with Belkins, so there's no reason why we should look anywhere else. We have enormous increase in our pipeline and the value of a pipeline in very, very short time span. The first 2 months were a spectacular event with a very limited effort in 2 or 3 weeks of doing the basic scripting. We had the first 2 months with 200 meetings that all led to different level of contacts and good pipeline opportunities. Belkins has a very smooth operation going with a model that is implementable. So they rolled it out and they have some jobs we need to do, and the better we do it, the better they work. What we have to do is provide the content, and they provide the structure and the form, which makes it easy for everybody because we have no idea about the structure and the form, but we have a lot of ideas about the content. We have had uncountable numbers of meetings. I cannot even begin to count them. There's so many. We have had 3 or 4 people more or less full-time occupied with doing client meetings and screening, and you know, it's been amazing because we have obviously hit a sweet spot. Nearly 9 out of 10 of these cold meetings we have with clients we've never seen before turned into follow-up meetings, and many of them went directly to board level because the interest was so intense. The net effect has been tremendously positive. We have had a lot of meetings, and we still have a lot of meetings. The biggest deal we successfully got based on the Belkins effort were probably engaging with the second largest healthcare provider in Germany. They are like 88,000 people corporation, and it's huge. We have a very good and very comfortable dialogue with these guys about moving forward. That's probably uniquely the most interesting, hopefully, client that we have so far been in contact with. We have a common mutual understanding about the value add that we bring, and Belkins has assimilated our vision and our storyline, and it's also they are very enthusiastic about it and they're very happy with it. So we're comfortable that they know what we're doing and they like it, and this will also positively affect the effort they do and the results that they provide. In the German market, it was in excess of 30%. In the Scandinavian market and the UK, it was around 12 to 15%, which is quite a lot. Belkins did a good job, and we brought something to the market that was needed and sought for and sought after at a time where the pandemic was over and people were now acutely looking for virtual care. Success is largely a question of being well prepared, and I think Belkins and we did a good job of preparing.